So Kawasaki disease is the systemic vasculitis. It is the condition that causes the inflammation in the wall of blood vessel in the body. Kawasaki disease is most common in the infant and young children. Some books said it is also called mucocutaneous lymph node syndrome. But when inflammation occurs in the blood vessel or when vasculitis develop, patient present with some of the sign and symptom of the disease. The sign and symptom we categorized by acute phase, subacute, or convalescent phase. In the acute phase, most common sign symptom, patient has a high body temperature, fever, usually body temperature more than 102 degrees Fahrenheit. And this fever unresponsive to antibiotics. Patient develop the red tongue, we call strawberry tongue. Or patient develop the red eye. And also eye should be dry. And you see the bigger size, we call xerophthalmia, red eye. Xerophthalmia also common in Graves' disease, endocrine problem, Graves' disease. And also patient have red lips here, or we can see the red oral mucosa and mucous membrane with edema of the oral mucosa and pharynx. Sometimes we see red plum and sole. So here red sole, you see in the picture, and red plum is the cardinal sign. If you palpate the lymph node enlarged and palpable, including cervical lymph node. And some patient present with cardiac complication, around 5 to 20%. Cardiac symptom, usually patient have a dysarrhythmia or myocarditis. What are the other sign symptom we can see in acute phase? Sometimes patient has a pallor of proximal fingernails or toenails. Superficial skin layer desquamated easily. As I told you, this problem or Kawasaki syndrome most common in infant or the children less than 5 years old. Conjunctival redness, patient feel lethargy and irritabilities. Even rash over the tongue, all over the bodies, even in the perineal areas. And occasional intermittent colicky abdominal pain, also most common. What else? During the subacute phase, all of the signs, symptoms, especially the fever, will be resolved. So resolution of fever or peeling the skin around the nail or around the palm or sole. And in convalescent phase, usually no clinical manifestation, but abnormal lab values. If you count complete blood count CBC or C-reactive protein CRP or erythrocyte sedimentation rate or albumin, all would be abnormal. When any patient develop the inflammation in the artery or blood vessel or chronic inflammation, C-reactive protein always go up. Hmm? So what are the treatment? If the patient present with all of the signs symptom of the Kawasaki disease, we give them gamma globulin, especially the intravenous gamma globulin or high dose aspirin. What are the nursing intervention? Because of our healthcare profession, it is very important to take care of them. So we monitor the cardiac function because some patients present with a cardiac complication like dysarrhythmias. If we do not treat the dysarrhythmia or myocarditis, it leads to the congestive heart failure or cardiac arrest. So always monitor the cardiac function. And also everyday or daily weight measurement important. We strictly maintain the input-output chart and educate the patient to avoid the live immunization at least for 11 months.